Rehabilitation, we are focused on quality of life. And so I think a lot of the other doctors and you'll meet are more focused on saving lives, and that's wonderful. But I think we touch patients in a different way and their lives in a different way by helping them improve their quality of life. In the inpatient rehabilitation setting, the members of the rehab team would be your physician, your rehab physician, your physical therapist, occupational therapist, speech therapist. There usually is a social worker involved as well, a case manager. On the outpatient side, typically physical therapy, occupational therapy again, and speech therapy. For physical therapy, they tend to work on mobility, endurance, strengthening. They may work on musculoskeletal issues if you have pain in a certain part of your body that they can work on. Occupational therapy, the focus is on activities of daily living, so things you do every day, like taking a shower, getting dressed. Those are called basic activities of daily living. And then there's more advanced ones like typing and writing and those type of things, and driving a car. You'll see some overlap between PT and OT, because if you want to go to the bathroom, you've got to walk to the bathroom. So you'll see the OT working on the walking as well. And then the speech therapist works on cognition, swallowing, and speaking. Also with speech therapy and occupational therapy, you may see overlap because a lot of the activities of daily living we do requires us to think and to be cognitively sharp to be able to do some of these things. So you may see both of them working on cognition. When you're in an inpatient setting, if it's the 3-hour a day, the intense rehab, that's usually about 1 to 2 weeks. There's slower paced rehabs. They're called skilled nursing facilities and long-term acute care facilities. And patients get about 1 to 2 hours of therapy there, and they'll stay there sometimes 2, 4, 6 weeks. Your goals are usually based on how do I get home safely? That's the goal. Not to get you perfect, but to get you home. So we take into account, who's in the house with you. What's your house like? Is it 2 stories? Is it 1 story? Do you have stairs to get in? Do you have someone to help transport you home and to your appointments? Those are the things we would ask. In the outpatient setting, the goals are very different. You should be at home already, so you should be safe at home. But things that you want to do, and actually the patient has a lot of say in the goals for an outpatient setting. What did you enjoy doing before? What were your hobbies? What do you have to do for work? What's your routine like? A lot of it's just trying to get you as close to what you were doing before as possible, if it is realistic. So the patient has a lot of say in it, and then the therapist and the doctor will help you determine whether those goals are realistic. I think the best advice is to encourage them to participate in therapy. Try to create an environment where they'd be comfortable performing physical activity. If they have to walk, maybe go out there and walk with them. And make sure you're available to transport them to therapy should they need it. And then I think being an advocate for your family member during therapy and during the clinic visits with your doctor, would help them as well.